Good morning.
Good morning. How are you?
I'm good. Very good. Thank
Good.
you.
So we were chatting over the weekend about this article that my friend sent me on Instagram. All my friends send me things they see that pertain to everything we do at the office.
Right.
They're always making sure I'm in the know.
And now you know enough that you can answer all of these questions.
That's
anyway.
right. Not really, though. But it was interesting because it was about the increased bladder infections, how bladder infections are
On the rise.
on the rise.
Yeah.
And that's one problem. And then the other problem is they are resistant to antibiotics,
Right.
strains that are resistant.
Yeah.
So I just want to ask you, first of all, why do you think bladder infections are on the rise?
I didn't actually realize that there were increased numbers of bladder infections. I really can't say I know why, unless the things that tend to precipitate bladder infections are really low estrogen levels, low hormonal levels, frequent intercourse, aggressive intercourse, dehydration, lack of the precautions that women should take on emptying their bladder before or after or both intercourse. What the situation is that estrogen keeps the tissues as healthy as possible, and it keeps the right pH, so the right level of acidity. That's important, and the resistance of the cells to bacteria and to infection. Now that's vaginal, it's not in the bladder, but it's bruising the urethra, and the bladder is a great little place for bacteria to grow because it's warm and it's wet and it's supplied with, you're going to have to actually just take that little bit out when you edit. It's so people often think they have a bladder infection. They don't really have one. Because they just have some urethral irritation.
And that's what I was wondering about when I read this article.
Yeah.
If people actually have a bladder infection.
And some of the tests, the at-home tests, are not entirely accurate.
And I think people are doing those.
And a lot of people are doing them.
Yeah.
What this means is that the patient calls the doctor and says, I have a bladder infection. First of all, they've got to get in touch with the physician's office to do that. The physician then needs to talk to them, or the office talk to them, and order an antibiotic. But what they also want to do, or should do, but usually don't, or frequently don't, is get a urinalysis with microscopy and culture to see if there's really a bladder infection. I think what happens then is that if those things aren't done, people are started on antibiotics, so there's more exposure that the bacteria have to antibiotics that are usually used.
Yeah.
And that because of mutations of the bacteria, they're always trying to survive and multiplying very quickly. They are more likely to get the mutations that make them resistant to the antibiotics. So if we could go back to everybody getting a culture, a urinalysis, microscopy, culture, before starting on antibiotics, that would be great. But at least getting that evaluation started would be helpful. I don't see any other reason why there would be increased evidence of resistance.
So nothing environmental that we're doing?
I don't think so. I think it is just...
or food or drink.
There are things that change the pH of the vaginal tissues in the bladder. And so if diet leads to those changes, it's more likely that they're going to be infections. So diet can play a part.
So what kind of diet would play a part?
I think carbohydrates.
Sugar.
More like
sugar. Yeah. Maybe like sugary drinks.
Yes.
Maybe that's it.
Maybe.
Think about it. Starbucks and all the sugary drinks.
Yeah.
Because it was like in the last 20 years.
Right.
I think it was.
Yes.
And that's been, Could be.
Could be. You may have hit on something here.
Maybe I solved it.
You solved the problem.
I'll call the New York Times. Let them know. All right.
Good.
Anything more?
Nope.
I think it's true, though, what you say, that I oftentimes have thought I had a bladder infection. And also people read the tests wrong because they have some red that
Yeah.
shows up.
Yes.
What is that shows up? Like,
Epithelial cells.
right. And they think they have
yeah.
a bladder infection,
Right.
but really that's just normal stuff that shows up. Doesn't
Yes.
mean you have a bladder infection.
Right.
That happens all the time.
Yes.
Because it comes back with the red alert.
Yeah.
But it doesn't mean a bladder infection.
Correct.
Yeah. I still don't know when those tests come back what is bladder infection. Because I look at mine and I'm like, oh, I definitely have one. And you're like, no, you don't. Yeah.
Bacteria in the bladder and the urine sample that goes to the lab does not mean an infection, because there's going to be contamination. As the bladder empties into the little pee cup, bacteria will be picked up, and if that analysis stays in the doctor's office till the evening before the lab come and pick it up, those bacteria multiplied, so there are tons of bacteria there. So we don't really pay attention to bacteria other than to grow a culture so we can be more specific about giving them an antibiotic. But in terms of making the diagnosis of a bladder infection, it's actually white blood cells that are the most significant. And those are essentially pus cells that are congregating there to try to fight the infection.
And that's what you're looking for.
That's what I'm looking for.
So when the red
time.
cells light up, you're not concerned about that.
Red cells would be there for other reasons.
Contamination or...
No, it could be red blood cells that are there with a bad bladder infection. They can be there, and that's significant.
Okay.
But they don't have to be there. And just having red blood cells there is not significant relative to a bladder infection.
Yeah.
It is on its own of note. So we'd wonder about that and evaluate that. But intercourse bruises the urethra, and that causes inflammation.
And then people think they have a bladder infection.
Yeah, and sometimes they get it.
Yeah. Okay. Thank you.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.